The following program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.
Good evening, ladies and gentlemen, and welcome once again to Your Health, Your Choice. This evening we have about 25 different scenarios of pain syndrome to share with you. I'm Linda Banks-Khan, and we have with us in the studio again Dr. Claude Khan, community diabetologist and senior pastor of the Untitled Chapel. It's May the 1st, and we're asking that if you have any questions that you want to direct to Dr. Khan, you can WhatsApp them. The number is 360-1005. 360-0105.
Okay.
Yeah. So, and of course, the call-ins will come in on the second half of the program. So, an integrative approach to pain syndrome.
So, we said that before we launched Tinted, I just wanted to revisit the whole idea of being overweight, or the term that we often don't like to use, obesity.
Yeah, and this is not about fat shaming.
No, it's not about fat shaming, but I think, you know, it's important when we have new research, and there was something published in either the BMJ or one of the peer-reviewed journals in the UK. It was a study with over 2.8 million people, and it showed that even people who were slightly overweight had about twice as likely a risk of developing type 2 diabetes. So that was the first group. Even if you were slightly overweight. Now we're talking about body mass index. And body mass index, as we remind people, it's your weight in kilograms over your height squared in meters.
Actually multiplying it by each other.
Dividing your weight by your height squared. And an ideal body mass index is between 19 to 25, although certain ethnic groups like the Indo-Caribbean and Asian population, we say it's a slightly lower BMI, about 23, because there's more body fat as compared to other ethnic groups. But some of the astounding figures was that not just that there was a higher risk of type 2 diabetes, but those with a BMI of 35 to 40, the risk of type 2 diabetes was almost 9 times higher and 12 times higher for something called sleep apnea. And that's a condition where your airways collapse at night, and it's not just snoring, as we used to think, but it's linked to hypertension, diabetes, heart disease.
It's depriving your oxygen, the brain of oxygen as well. Yeah.
But it's also linked to hypertension, diabetes, etc.
Right.
People with, so you have people who are overweight, 25 to 30 BMI, people who are stage 1 obesity, 30 to 35, stage 2, 35 to 40, and then people who are severely obese, that's a BMI of 40 and above, 40 to 45, they're 12 times more likely now, 12 times more likely to develop type 2 diabetes, and a risk of sleep apnea that is 22 times greater. And then people with a BMI of 40 to 45 are triple the risk of heart failure. Now, that's the bit I wanted to emphasize, because we knew that being overweight is linked to heart disease, diabetes, hypertension, etc.
But the statistics are astounding.
The statistics are astounding, and now it's also been linked to heart failure. So while we are not fat shaming, we are seeing that there's an epidemic of obesity in Trinidad, in the Caribbean as a whole, and we need to approach it in a sensitive way and raise the awareness. I mean, I saw a young boy this week, 16 years old, with type 2 diabetes. Type 2 diabetes, he's about 250 pounds. And his blood sugars were almost 300, and it wasn't type 1, it was type 2 diabetes. And really,
so juvenile diabetes is on the increase as well.
So when we say juvenile diabetes, I want to be careful what we're talking, because when we talked about juvenile diabetes, we normally refer to type 1 diabetes. So what I'm talking about here is type 2 diabetes in young people.
Yeah.
I wouldn't call that juvenile diabetes. I would just say that it's type 2 diabetes in the younger population is on the increase because of obesity, sedentary lifestyles, etc.
Yeah. Okay.
Yes.
So we're taking an integrative approach to this, to health, on this program, where we try to educate the community on what is good health practice. And then, you know, they can evaluate the situation, deal with preventative measures, and then seek treatment if they need to from medical practitioners. So let's move on to the main focus of the program this evening. We wanted to share with you 25 different scenarios of pain syndrome. I know the first one is surprisingly on that slide, or first slide.
Yes.
You will be surprised by this one.
Slide 1 on the PowerPoint. So that's...
Those are flip-flops.
Flip-flops, yes.
Yes, flip-flops.
And
actually, in Australia, they call them thongs, but yeah,
really?
flip-flops, yeah.
Okay, okay, I thought that referred to something else.
Me too.
Okay, so flip-flops, why are we showing that? So we can come off that slide. A lot of people come in with foot pain. A lot of my diabetic patients come in with foot pain, and you know, very often it's neuropathy, nerve end pain, etc. But what we're trying to show here is that there are some simple things in life that if we are not careful, you can end up with problems. So flip-flops, the problem with that is that basically your the arch of the foot is not being properly supported. And it's very important with diabetics, that's my specialty area, but generally in the population, that you wear proper footwear, and sometimes you can have an insole that can give you an arch support, because you can have various types of foot pain. People come in with burning in the feet, numbness in the feet, that's what I see a lot of. But then people come in with heel pain. And that's
plantar fasciitis.
Plantar fasciitis, or heel spurs, and it's common in diabetics, but it's common in the general population. And again, if you're not wearing proper footwear with a proper heel support, your arches can eventually collapse. You can end up with major biochemical problems with the feet.
And does it affect the spine as well then?
It can affect the spine. So yeah, so if you know, people come in with back pain, and we end up going into all kinds of fancy investigations, MRI scans, CT scans, etc. And I'm not, you know, downplaying that. There's a place for all of that. But sometimes simple measures, simple investigations. Now, sometimes footwear, for example, I saw a patient this week, and he has what is called a Charcot's foot, which is a it's a foot that is it's all abnormally shaped because of repeated trauma due to diabetic neuropathy, and he had to get special footwear, and it was over $7,000. Wow!
So you could prevent that by not wearing flip-flops regularly.
Right. So the flip-flops, apart from the support, let me just come back to diabetics. The problem with the, as you call it, the
bit that goes between the big toe and the next,
especially in diabetics, that is very dangerous, because if you have diabetic neuropathy, you can have blisters forming, and you don't feel the blisters, and a simple blister can end up with a big problem. So we're talking more about the pain at the bottom of the feet here with flip-flops. So, but also it can apply to diabetics, etc.
Right. Okay. So that's pain scenario number 1. What's number 2?
Right. So we have our good old smartphones.
Yes.
And there are 2 or 3 problems we're going to talk about here. So we can bring up slide 2, right?
Yes.
So look at the person with his thumbs, and he's probably doing like we do all day, sending messages on WhatsApp, etc. So we can just come off of that slide. And very often, patients present with pain at the base of the thumb.
Yeah.
And it's a problem that is becoming more and more common. It's basically repetitive strain injury.
Yeah.
And people develop arthritis of the base of the thumb, and also the tendon here. There's something called de Quaver's tenosynovitis. So it's a tendon.
It's a tendon.
It's a tendon that comes here, and it can be very, very painful.
Yeah. But you know, you're playing video games as well with those thumbs, aren't you, all the time?
Right.
And what about text neck? That's,
I think yes.
Is that coming up? But it's connected to using your phones as well, because you're constantly doing down on it. Yes,
but a lot of people come in with thumb pain, pain in the wrist area, and we show the smartphone, but if you're using computers a lot, just generally computers, or if you're working with your hands, I mean, workmen who are using those
shovels and trowels and drills,
etc. It's causing a persistent vibration kind of trauma onto you get repetitive strain injury. And so the tendon around the wrist can become inflamed, the base of the thumb can become inflamed, and the tendon here. So what is the treatment? Well, of course, it's trying to use your phone less.
What about if you have a job in that industry? What do you do?
Right. So you can, there are a variety of things that normally the orthopedic surgeons or family doctors would handle this, but one of the things is getting a proper wrist support that gives you good support around the thumb area and around the wrist. Anti-inflammatory painkillers like Olfen, Cataflam, or Coxia, but I want to say that you have to be cautious about overuse of painkillers. And some doctors, if it's de Quaver's, will give an injection a steroid injection into this area, which you have to be a little bit cautious. I don't do that myself, but I let the orthopedic doctors do that. So there are various interventions, but it is a repetitive type.
So maybe one of the things you could do is practice holding your phone up to eye level, or having your computer screen at eye level, so that your neck isn't getting that repetitive text neck syndrome as well. I've felt it actually.
Yes, because you use your phone a lot.
I do.
Yes.
Okay, let's move on to number 3.
Right. Okay, so this is a rather strange one. It might surprise people, so I'll bring up slide 3. So it's the phone in the back pocket, or your wallet, not just the phone, the wallet in the back pocket. And it can cause pain in the buttock area, but even pain shooting down the leg. So this may surprise some people. So again,
and some phones in the pockets are very heavy as well, aren't they?
Yes.
Heavy, and the heaviness can affect your spine.
Right. So again, a lot of patients come in with pain in the hip area, pain shooting down the legs, and this might seem to be a simple problem. I think what we're trying to demonstrate tonight is, you can look for very complex reasons for this underlying pain, when it might be a simple thing like having a wallet and you're sitting on it. So what's advised here is that it's removing your wallet before sitting.
Or your phone.
Or your phone before sitting. I notice a lot of people have their phones in their back pockets.
Yeah, it's what's done. That's what the jeans pocket is for now.
Oh, really?
Yeah.
Okay. Especially females tend to have their wallets in
so they need to watch out for their spines.
Yeah. So the wallets, so if you're having pain in that area, it may not be as serious as you think. It could just be a wallet being worn there, and it's triggering pain shooting down the leg.
Right, now we have 25 of these to go through, so let's move on quickly to number 4.
Yes. And we'll remind people of the WhatsApp number.
Yes, if you have any questions for Dr. Khan on any health issues, you can WhatsApp us on 360-0105, 360-0105. I think it's coming up on the screen as well.
Okay.
And this is a recorded program. This is a live program tonight, but if you're if you're watching us on Thursday or on Sunday, it'll be recorded. Number 4, driving.
Right. So this is a big one. So you can see that person is kind of leaning forward.
Yeah, that's bad posture.
Bad posture.
Yeah.
But the car seat is at the wrong angle. Yeah. If the seat is reclined, You may slouch forward to grip the steering wheel, and this pulls your head away from the headrest and can cause neck pain. So let's just talk a little bit about that, because again, you know, a lot of people spend hours
in cars.
If you know you're working in Port of Spain, you might be 2 hours up the road and 2 hours back down, and you end up with neck pain or even spine pain. And again, you know, sometimes different people are driving the same car. I mean,
we have to readjust every time we get in. Readjust the rearview mirror, readjust the way that you hold the steering wheel, the distance of the seat from the steering wheel.
Right.
So the ergonomics is important.
Yes. Because I noticed when you drive our car, either one of the cars, you the seat is almost up to the steering wheel. Yeah. And I have to put the seat right back to be in a comfortable position. Yeah. So you find it more comfortable. It's not that you're that short that you have to put a seat, that you have to put a seat, but for some reason you're more comfortable.
I want to see beyond the bonnet of the car. Yeah.
Okay, no, that's fair enough. I mean, I think it's everybody finding a comfortable.
But if you put the backrest at the right angle, you should be fine.
So what that photo showed is that the woman was actually leaning forward.
Yeah, and you see her neck and chin are going forward.
Okay, yeah. So what would result there is that patient will end up having pain at the back of the neck, and just slightly down the spine, and you know, you might, after years of doing that, you might do an X-ray and you might see a bit of arthritis of the spine, and then you have to go into, you know, physiotherapy and all kinds of other interventions.
That's
cervical spondylosis. Spondylosis. Yeah. But very often neck pain, no, I'm not talking about older age groups, because of course, if you're in your 50s and 60s and you start getting jaw pain and etc., you have to think about your heart. But you know, people in their 20s and 30s, very often they come in with neck pain, and it could be the spine, but it could just be muscular as well. Yes. Because if you're driving like that, it may not be the spine at all. It might be the sternocleidomastoid muscles. These muscles on the side here can go into spasm and become very tense, and just a gentle massage
will help. Okay, yeah. Great. Okay, well, we just got the signal that we're moving into our first break. We've covered 5 of the 25 pain scenarios as we look at pain syndrome this evening. So don't go away. We'll be right back after the break with the other 20 pain scenarios.
Looking for a safe place for the whole family? Well, now you found it. We are ACTN The Voice, your family-friendly station. Whether it's current affairs, kids and classic TV, sport and community features, Christian and music programming, plus so much more, ACTN is the station for you. Join us each day for programming that puts morals, values, and family first. We are ACTN The Voice, your family-friendly station.
Hey, I'm Jason Bates, your pastor of Faith Assembly International, and you're watching ACTN The Voice. Thanks for tuning in. I deserve to die for my sin, but instead he gave me life. What the greatest exchange. He looks at me and he looks at you and he says, come, bring your mess. Bring your sin, and I will give you forgiveness.
ACTN The Voice, your family-friendly station.
Okay, welcome back to Your Health, Your Choice. I hope you got that medical trivia question right. 60% of our bodies comprise of water.
Yep.
So we are looking at the pain syndromes. We've covered 5 of them so far. Let's move on quickly to the next one, video gaming, which is probably connected to the one that we talked about when we mentioned the smartphone and the thumbs.
But that was just a thumb. So slide 5, right, shows, is that the Wii game or something?
Yeah, that's a Wii.
So that's where you're kind of doing the
excited
actions.
and
the problem with this is that you can end up with sporting injuries because you're trying to mimic what's happening on the screen, and if you don't warm up properly, stretching, etc., you can end up
just as you would.
Yeah. So just to just come off that slide. So again, I mean, I guess this might be younger people, but you can end up with shoulder injuries, elbow injuries. You know, well, I did this wee thing in my younger days when our kids were younger, and it's the lawn tennis, and so you're doing that action,
repetitive action,
and you can end up with tennis elbow.
Yeah.
Right.
So the same warm-up exercises you would do for the actual sport when you're playing those games, you need to do those to warm up, relax the muscles a bit.
So and of course, if you find you're having those pains, then you need to look again at your lifestyle and see if it's connected with one of these simple things. Because again, you can end up doing all kinds of investigations when it's a simple thing,
expensive investigations. And it could be a simple problem. Okay, so that's scenario number 6. What about cheese?
Right. So look at all those nice cheeses.
Yeah.
They look very nice, and cheese lovers take note. So what are we going to talk about here? A lot of these different types of cheese have something called tyramine.
Okay.
And high amounts of tyramine, and that's a notorious trigger for headaches. Migraines. Yeah. It's also found in some beverages like wines, beers, etc. So I want to talk about headaches for a minute because there are other reasons that we'll come up against. But very often patients come in, and the first thing people think about when they have a severe headache is whether it's a tumor, and then we rush you into CT scans, MRI scans, etc. I just want to remind you that migraines, MRI scans, CT scans will show nothing with a migraine. There are some very sophisticated investigations that are available in the US that might show certain changes with migraines, but I don't think it's easily available here in Trinidad. So dietary triggers are very, very important. So this substance called tyramine, which I don't think you'll actually see on the food labels, I don't think so. It is a trigger for headaches. And of course, we know migraines can be extremely severe.
Yeah.
And what we often say is that if you're having just one migraine a month or so, it's not a problem. But if you're having weekly migraines, then we have to really go into the history. I often tell patients, when I used to do more family medicine, that it's a headache to try and diagnose headaches.
But keeping a food diary might be a solution to that.
Absolutely. I mean, food diaries.
We're more and more conscious about what we're putting into our bodies now, and I think, that might be a journal where we look at what we're in. Because obviously what we ingest affects our bodies. And
the food diary and looking at when you do have a headache, what helps? Yeah. So if you find that if you go and lie in a darkened room, for example, and you lie still for a few hours and the headaches improve,
then you have a migraine and you don't need those major investigations.
One of the danger signs is if you find you're getting up in the morning first thing with a severe headache. That is a little bit worrying because it's not related to activity. You've rested all night. Of course, if you have, like we had over Carnival, loud bounding music from the Barra
Well, that was going to be number 25,
Okay,
actually.
noise pollution.
Noise pollution is a
Yes.
pain syndrome.
Noise pollution is a pain syndrome. But of course, if you're not sleeping well at night, etc.,
Yeah.
you may have a headache in the morning. But by and large, cheeses, wines, beers, some of these things have this substance called tyramine, and we have to be cautious if it's triggering headaches.
Okay. What about number 7?
So number 7 is a nice photo of someone seeming to be relaxed, couch potato syndrome.
She's got the remote in her hand.
Yes.
Yeah.
And but if you look at her position, she's kind of turned to her side, and her neck is. It doesn't look like she's in a
Angled,
comfortable
yeah.
position.
Yeah.
So if you just lying down, and if you're looking at a lot of television, etc.
Netflix.
Netflix, yes, which can be very addictive.
Yeah.
You need to find a comfortable position. And even if you lie down and you're straining your neck, and that probably goes, I think we have a slide for different sleeping positions as well. That can cause neck pain, shoulder pain, etc. So simple
the couch potato syndrome.
yes, couch potato syndrome is very important.
The next one?
Right. Well, this is for all parents. It's the baby syndrome.
Baby lifting.
Baby lifting syndrome. The simple act of lifting your baby out of the crib each day can lead to the same De Quaver's tenosynovitis. It's a repetitive strain that causes pain and swelling in the wrist. And learn to lift. So you're trying to lift your baby without straining the wrist. So how do we do that, Linda? You had young babies a long time ago.
I'm not sure how you do that. I mean...
Well, they say place your hands under the back and buttocks and lift with the bigger muscles of your arms. So rather than... If you looked at the diagram, the person was lifting from under the baby's shoulders.
Right, yeah.
Right? And that's kind of putting
that helps them feel very secure, though, that you're covering the entire body.
Yes, and the baby seems to be very pleased.
Yeah,
has a big
they
smile.
love it. But it's straining your wrists.
If you're doing that repetitively, and you know, a lot of young mothers, you notice some, so that's one syndrome with babies, but some people tend to hold the babies on the side and with one arm.
Yeah.
And I have had a few young mothers coming in with shoulder pain. And when you take the history again, you see that the way they're lifting the baby, it's all the weight is going on just one area.
So those papooses are very good because it distributes the weight very well when you're carrying.
Yeah. You used to use those?
I used to use a yeah.
I don't see them, well, I'm not out much in the malls now in Trinidad, but I don't know if it's used. A lot of fathers, it was very popular for fathers in England to use these devices. What was it?
A papoose.
A papoose. That's a nice word.
Yeah, it's from the Indians, the North American Indians. That's how they used to carry their babies, either on the front or on the back.
Right.
Wrap them in, and they feel very secure.
Yeah. Right. I see one or two questions coming up. Let me see if I get one. So there's a question here. Hi, good evening. We'd like to inquire what causes excessive sweating. Like literally you need your body like almost every time. Thank you. Great show as always. Okay, so excessive sweating. We said you can WhatsApp. Thanks for the question. You can WhatsApp any questions tonight. We have opened it up and we're going to open the phone lines.
Yes.
Now it's
652-4855. 652-4855 for the call-ins and 360-0105 for the WhatsApp questions.
So excessive sweating can be an overactive thyroid. It could be, depending on your age and the menopausal period. And remember, there's a male menopause as well as female menopause. I mean, we're not just talking about women. Of course, if you're not, if you're overweight, yes, and if you're not highly if you're not highly active, but the common reasons could be a thyroid problem, could be overweight, could be hormonal, etc. So you would need some blood tests done to see what, and of course, anxiety. So let's not just focus on the
Panic
physical
attacks,
panic
yeah.
attacks, anxiety. We have another question, Lynn. On
Oh, we
WhatsApp.
do? Yeah.
Good night. I used to get major headaches up until March. My doctor prescribed Artans syrup of hemoglobin, as he realized I had a very low blood count, low hemoglobin, and low blood pressure back in February. This medication has seemed to prevent my headaches. Is there a correlation? Right. So very good question. Is there a correlation between low blood count and headaches? Yes.
Yeah.
Because if you have a low blood count, you're not getting oxygenation to the brain. And as a result of that, yes, you can get headaches. So that was a good diagnosis from your doctor.
Right.
Let's
I think we have
congratulate him.
a caller on the line now. Yes, good evening. Can we have your question, please?
Hello?
Hello, yes, we're hearing you.
I have an umbilical hernia. How dangerous is this? Is it life-threatening?
Umbilical hernia?
Yes.
Okay.
It's in my navel.
Right, yes. So umbilical hernias are very common. A lot of young kids have umbilical hernias. Is it very dangerous? I would say it's not very dangerous unless it gets obstructed. So a hernia is basically, you can have an umbilical hernia, you can have a para-umbilical hernia, which is around the umbilicus. You can have an inguinal hernia, which is lower down in the groin area. A lot of people live with this for a long time, and there's never a problem. But if a hernia is basically a weakness in the abdominal wall muscles and the bowel begins to protrude. Now, if it becomes so, sometimes the hernia can come out when you cough or when you lift something heavy, and then it goes back in. But if the hernia becomes obstructed, that's when you can run into problems. So really, your surgeon, and it's a surgical problem, needs to assess that and see if it's an urgent problem or not.
Okay. Right. Are we going back to our pain scenarios, or do you have another?
Well, we have one more question here.
Yeah.
Good night. Can you explain about pain in both sides of the abdomen? Wow. Well, that's a big one. Pain in both sides of the abdomen. You have the kidneys on both sides. It's in the flank area, the kidneys are there. Kidney stones, kidney infections. But of course, you have the bowel as well. Now, if it's pain on both sides simultaneously, it's unlikely to be the bowel. I would say, so I'm assuming that you're talking about pain in the flank areas, that's higher up, not lower down, and I'm not sure if it's a male or a female. But you probably need at the least an ultrasound of the abdomen as a first investigation with a few blood tests, maybe a urine test, and then some further investigation. So it could be kidneys, it could be the bowel, depending on what your age is, but basically you need to be examined, etc.
Okay.
We have a lot more questions coming in. I don't know if you want to...
I think Josh said we had another question.
Yeah.
Caller on the line. Yes,
So
good evening.
Hello, good evening.
Yes.
Yes, want to find out what causes stiff muscle in the neck.
Causes, sorry?
Stiff muscle in your neck.
Right. Okay. So we talked about that. The
Earlier.
stiff muscles in the neck. There are two major muscles on each side of the neck, the sternocleidomastoid muscles, and this supports the neck and the cervical spine. So if you have arthritis of the spine, you can get stiffness of the muscles. If you're not sleeping well, the pillows, if your mattress doesn't give you good support, you can have back pain as well as neck pain.
Yeah.
So really, again, you need to do some simple investigations, a simple examination. Very often, it may not be a serious problem. It may just be the muscles going into spasm. Simple massages, using of some rubs into the area, and some anti-inflammatory medication can work. So it's probably the sternocleidomastoid muscles.
Okay. Right. So are we back to the pain syndromes again, or do you have another WhatsApp question?
Well, I think this was a follow-up to the person who rang earlier, who WhatsApp earlier, saying that I'm only 29, I've been sweating like this all my life, but it's happening even more now, and I'm slim and healthy, a female. So what I would say is, I guess you have had investigations done. You may need to see an endocrinologist or dermatologist and there are various very good people that you can go to.
I did have two friends who used to have very, very sweaty palms,
Right.
and they used to have to walk with a rag all the time to keep drying them. So
Right.
that would have been a dermatological one.
A dermatologist, yes.
Yeah.
I mean, I used to see quite a few people in the UK with this problem, and it's not a tropical country,
Right.
so it's not really the temperatures.
No.
It's just something in your metabolism,
Yeah.
and occasionally we would do extensive investigations and not come up with the answer. But there were certain underarm deodorants, certain creams that can help. So I would say you either need to see an endocrinologist, or a dermatologist to get that looked into.
We have another question. We have another call on the line. Good evening. Do we still? Yes, good evening. Can we have your question, please?
Yeah, call about pre-ejaculation.
Sorry, pre-ejaculation?
Yeah.
Okay. All right. So we are talking to an adult audience. There might be some
but it's
kids.
before 9 o'clock.
It's before 9. But no, I mean, it's a medical program. So pre-ejaculation is basically a man climaxing before he's able to penetrate and have an adequate sexual relationship with his partner. Now, a lot of people confuse erectile dysfunction with pre-ejaculation, and it's two separate problems. So I see a lot of men with diabetes with erectile dysfunction, and it's due to testosterone levels, etc. Pre-ejaculation is more linked to sometimes anxiety, technique, being very plain here and saying that for a man, a man can be aroused very quickly, whereas a woman may take a longer period to get there. And the tip of the penis is the most sensitive area. So what I would say is that you need to see a urologist now, not an endocrinologist. You need to see a urologist who specializes in that kind of area, and they may have different therapies that they can offer you.
Okay, right. So we've looked at 9 so far, no,
Yes.
8 so far. We still have quite a few to go, and the next image is a laptop case. And we've just got the wrap-up signal to go for our second break. Don't go away. We'll be right back with Your Health, Your Choice, and see if you can answer this medical trivia question.
Well, a pleasant good afternoon and welcome to Cloud 9 on ACT and The Voice. I am Sheldon Yearwood.
To bring some relief, to those who were badly affected.
Is that real best bike, Jasmine? I got to go now.
What we feed into the soil and how we water to determine the kind of fruit that we bear.
Lazy boat, lazy man.
El bote, hermano.
Thank you very much. God blessings to you, and of course, be safe.
Okay, so that question was about pain receptors, and there are over 3 million of them in our bodies. As our topic this evening is on pain syndrome.
We've been bombarded by questions, but I know you wanted to. Maybe we wouldn't be able to cover all of these, Lynn, tonight. Maybe we can do the second show back on this. But you wanted to show slide 9.
Yes.
Slide 9. This is the laptop or bag.
Yeah, school bags were a big problem for kids. You know.
Yes.
Do you want to explain how the weight again? It's almost like the baby syndrome.
So yeah, I mean, you're carrying the laptop or a heavy bag, and that can cause pain on the elbow area. So you can end up getting even like a tennis elbow.
Or the shoulders.
Or the shoulders if you're wearing it around the shoulder. So shoulder pain, elbow pain, and that's why it's probably better to get the rolling. Type.
There's a rolling, and laptops are coming much lighter now anyway.
Yes.
But yeah, the rolling book bags are highly recommended for children in particular, because you don't want them developing spinal injuries.
Absolutely. And I just want to show the next one, slide 10, before we answer a few more questions. Slide 10, which is the, a lot of people have these different hairstyles.
Yeah.
And if you're doing your hair, well, you could probably explain this a little bit more, Linda.
Right. So, yeah, the tightness of the braids or the tightness of the hairband or the headband or the bun that you wrap on your head can cause headaches. So I guess the solution is to just keep your hair loose, wear it loose.
Yeah. So let me answer this question about severe spondylitis. Is there a cure? So we talked about so spondylitis can be in the neck, it can be down in the lower back. It's
What is spondylitis though? What is it?
Spondylitis. Okay, so you have spondylosis. Spondylitis is also an inflammation of the spine, and it's the spine gets affected. The nerve roots can get affected as well. And really it's an orthopedic problem or a neurosurgical problem. As far as I'm aware, there's no cure for this. So it's physiotherapy, it's pain relief, etc. Now, if an MRI scan shows a prolapsed disc or nerve impingement, then something can be done about that.
Do you have another question?
Well,
yes?
we have loads of questions.
Okay.
How can numbness in the feet be treated? Very helpful program. So numbness in the feet. So numbness in the feet can be due to diabetes. Of course, I see a lot of people diabetic neuropathy. It can be due to vitamin B12 deficiency. It can be related to hypothyroidism. So you have to do some investigations. If it's diabetes that has been there for a number of years, it's not an easy problem to turn back.
Yeah.
We give sometimes something called alpha lipoic acid, which is a natural supplement, vitamin B12, but it's about protecting your feet.
Okay, we have another caller on the line. Good evening. Good evening. Can we have your question, please?
Yeah. Hello, doctor.
Hello.
Yes.
Good night.
Good evening.
Good night. Thanks for the information. What I want to find out is that pain on the hip, on the right side hip, right? It comes intermittently, not every day. Only sometime on the hip, and it comes for a short time, and then after it goes away. Only on the right side. It's not.
How old are you?
I'm 76 years.
76. Have you done an X-ray of the hip?
Yes, we did an X-ray, and it shows nothing. Everything was clear.
Okay. Did you do anything further than the X-ray, like an MRI scan of the hip?
No MRI scan or so. But it doesn't pain all the time, you see. It's just intermittent, not today.
Is it directly over the hip?
Not really directly, you know, at the side. Like it's free now. 2-3 days, it doesn't pain.
Right. So remember, around the hip you have ligaments. Okay, so let me explain something about X-rays. When you do an X-ray of the hip, you're only seeing muscle. You're not seeing ligaments, you're not seeing tendons, you're not seeing... And it's the same like the shoulder joint. A lot of people get shoulder pain and they do an X-ray and they're told the X-ray is normal and they still have severe pain and it's a frozen shoulder. And no X-ray will show that. And that's why sometimes I know it's expensive to do an MRI scan and things like that, but around the hip as well, you have bone, you have muscles, you have ligaments, etc. So, you know, seeing someone, if you have done the X-ray, there's nothing, then maybe seeing someone like a physiotherapist or an osteopath It's, at our center, the Anaposis Center, we have a UK-trained osteopath, and we I refer a lot of people to her with lower back pain, etc.
So be the sleeping position as well.
It could be, yes.
One side. It might, or mattresses, the mattresses as well, if they're too soft or too hard. I'm told that it affects, it can't be. We have another caller on the line. Good evening. Can we have a question, please?
Hi, good night.
Good night.
Yeah,
yes.
Good night.
Yes, good night.
I am 52 years of age, right?
Yes.
And my hands and legs, they feel kind of tight. Numbness in the legs and the arms, the fingers. Like the blood circulation not flowing.
Are you diabetic?
No.
Have you done any investigations?
No.
Okay, so numbness, tightness, it's a very vague kind of symptom. I think, again, it could be just simple. If you're not exercising, etc., the muscles in the legs, etc., can begin wasting away a little bit. The numbness, again, it could be a vitamin deficiency, it could be diabetes, it could be hypothyroidism. One of the things, if you're having a lot of numbness, is doing something called nerve conduction studies, which a neurologist would have to do. So really, it's a bit of guesswork telling you exactly what the problem is, but at least you should see your medical doctor and try and be examined and see if there's any investigations.
Okay. You have another WhatsApp question?
Yeah, yes. And actually, this one is interesting. They say they've learned a lot from the program. Tell me more about pain, either the left or right of the pelvic area a couple days before the menstrual cycle. Now, this is really a more gynecological problem, but from my days way back, just before the menstrual cycle, you have the eggs having been formed, and if you have follicles in the ovaries, if you have cystic ovaries, polycystic ovaries, or there are any abnormalities there, because it's in the pelvic area. What I would say is that if the pain is persistent, then you probably need an ultrasound of the pelvis just to see if there are any cysts on the ovaries, and you need to be examined. But most probably, I would say, if it's just before your cycle, it's probably related to the ovaries.
Because your womb is preparing itself as well, isn't it? It's building up the
ovaries,
the walls,
the uterus, etc.
Yeah. Okay, we have 10 more minutes left, and I think we've only got to number 10 of our 25.
Number 11?
If we just do as many as we can, as quickly as we can.
Well, I don't want to rush. We can do another program on this because, in fairness, we told people to WhatsApp.
Call and thank you for your WhatsApp questions and your calls.
Yeah. Can we just show slide 11? Slide 11. And this is just about smells. There's a cologne or perfume that is being sprayed, and strong smells is another common migraine trigger.
Yeah.
And paint, smoke, etc. Even pleasant smells like perfume and fresh flowers.
So again, you need to keep a diary of the kinds of things that trigger off these, what you're smelling.
Yes.
So we're not doing any more pain. We're just going to answer questions, and there's a caller on the line.
Yes.
Good evening. Can we have your question, please?
Yes, Doc.
Yes?
Can we have your question, please? Thank you.
I said, when I'm walking, like I do plenty walking, I just feel by my side, my foot, I always pulling.
Ask him how old he is.
How old are you?
I'm 59.
59. You're not diabetic?
No, not diabetic. When I check my sugar, I take all the medical things, and it's I'm not diabetic. I check my sugar, I have pressure, nothing. But if I do plenty work, I do garden work now, I just feel my foot pulling.
He uses his,
Right, so you're on your feet a lot?
Yeah, on my feet a lot.
Right, so again, we talked about this at the beginning of the program, proper footwear, because if the arches are not well supported, it's almost like a repetitive strain injury. So you're putting a lot of weight on the foot, you need maybe to see a doctor, or maybe just try and get proper footwear. There are people who now specialize in orthotics, examining people's feet and giving special footwear, etc. So it may just be a problem with the arches in the foot. You
have another question?
Another question.
Yes.
Good night. With a change in lifestyle and diet, can we reverse diabetes and hypertension and therefore reduce or eliminate medication? Well, it's a big one. A big one. I would say reversing, yes, if you're very overweight and you're early on in diabetes and hypertension, significant weight loss, change of lifestyle can reverse some of the changes with diabetes and hypertension. However, it's, for example, a patient I saw today, they actually had gastric bypass surgery about 5 years ago, lost about 100 and something pounds, and yet they came back today with an A1C of 9.1%, which means that the blood sugars are now completely out of control. So although the diabetes responded initially with the gastric bypass surgery, because there was a strong family history of diabetes, the genetics influenced the diabetes.
But do you have to change your diet when you have gastric bypass?
Well, the diet changes because you have to now be more conscious of certain nutrients that are not being absorbed. One of my concerns, and I might be corrected by the people who are doing gastric bypass surgery, I'm not sure if there's long-term follow-up of these patients. I know in the UK, for example, one of our good friends, she's a gastric bypass specialist nurse, and when gastric bypass surgery is done, they follow up patients for years, monitoring their nutritional status, etc. So nutrition...
I think the tendency is once you've had gastric bypass surgery is that, okay, I've lost the weight, my diabetes is under control, then I can eat anything and go back to the lifestyle I had before.
Right, and that's a mistake, because you can either put back on the weight or the diabetes can come back. So there's a certain amount of reversal, I agree, but you have to be very cautious, and every patient is different, and that's where, you know, the follow-up of these patients is important.
Right. I think we have another caller on the line. Good evening.
Hello, good evening.
Yes, can we have your question, please?
Yes. I'm 69, almost 70. I'll be 70 years old in July. But what happened, I do feel a kind of tightness just above navel, like where my skirt waist will be, around that area. Sometimes I feel a tightness.
In the abdomen area?
Pardon me?
Just above around the tummy button?
Not around it, above, like where my skirt waist will...
Right.
And waist.
Okay.
A tightness.
A tightness?
Yes, like sometimes I feel a tightness.
Okay, and how long has it been going on for?
It is about a little while now, maybe like 2 months or so.
2 months, okay. Have you seen a doctor for it? Have you seen anybody?
No.
Okay. No, okay. Just the fact that the skirt waist is there, it could be some pressure from around that area. But, I mean, at 70, I think she said, really, any kind of abdominal discomfort, etc., at least a doctor should lay a hand on the tummy, examine the tummy, etc., and just to make sure there's nothing to feel, there are no masses, there's nothing. So I would say...
So you have the intestinal...
Right, you have the ascending bowel, the small bowel, and then the transverse colon, descending colon. So at least you should see someone and just to examine and make sure there are no problems.
We've been told we have 3 minutes left.
Oh, 3 minutes left. There was one last question here, which was pain. This was the one about pain on both sides of the abdomen. Considering the pain in the abdomen, I'm a female and did CT scan, ultrasound, liver is swollen, kidneys have stones, but stomach is getting bloated and unable to eat many dishes. So we talked about that. So she has several problems. So we only have about 3 more minutes, Linda. We're probably going to have to revisit this.
Yeah, we were only able to get through half of the 25.
Yes. So I just wanted to mention the diabetes wellness centers that we have pioneered. We have 3 centers, one in Vistabella, 4824269. We now have a center in Pinal, which is 1190 SS Eron Road, and the number there is 0720 on a Friday, and then Shogunas 665-1141. So we are spread out a little bit, and why we call it diabetes wellness is that we try to take a holistic approach. We
educate, evaluate, prevent, treat.
We have a clinical psychologist. We have there's an osteopath there. There's another doctor, Dr. Cruz is with us, and then of course you have your teaching center. So the Anaposis Center is made up of many arms, and of course we have the church as well.
Okay, so you want to put your pastor's cap on
pastor's
and wrap
cap, yes. Well, so the Anaposis Chapel, if you don't have a home church, we want to take this opportunity to invite you 9 a.m. on Sunday mornings, number 12 Johnson Street in Coquille. When you're passing on the bypass at night, you see a big lighted cross, we say that we're a Christian faith community. I want to say one of the things I preached on Sunday morning was I shared with our church the Hebrew word ahava. Ahava is God's love. And we shared with the church that because God first ahava towards us, in other words, he showed us his love, we can then show that love to others. And what I want to challenge you is, I know there are lots of concerns and a lot of people posting things about the immigrants who are coming into our land. I want to congratulate you, Linda, for you and the group that you're doing a fabulous job, Anaposis, with the La Romaine Roman Catholic Parish, Monsignor Christian Pereira. They have opened up the parish, and two churches that are different in style have come together, and you are now with other teachers and other people, 30 to 40 kids, and you know, helping families who are severely in need. Can I say that we have to, our Christian love is not just words. Love is a verb, not a noun. Love is shown by action. It's the way we act, the way we interact, and the way we reach out to those who need our love and compassion. So I want to challenge you, show God's ahava to those around you.
Yeah, especially now that we know that the Venezuelans they have families involved in the coup attempts, and they're very, very unsure. They don't want to be here. They have had to escape extremes and poverty. They've lost everything and come to an alien land. And we have been mandated by God to look after the strangers in our land.
Absolutely.
So I'm totally for helping the kids. I know that there are others who are against it, but I think if we don't deal with this situation, we will reap the fruits of discord and social unrest eventually. So we're closing up Your Health, Your Choice this evening. It's the 1st of May 2019, and as the week progresses, may you be physically revitalized, emotionally uplifted, relationally connected, and spiritually strengthened. Good evening, and we will see you in a fortnight's time with another edition of Your Health, Your Choice. And thank you to Shelley for doing my hair and makeup today.